If your shoulder hurts when you wake up in the morning, then this video is for you. I'll share tips to prevent shoulder pain from sleeping, as well as what to do if your shoulder does hurt when you wake up. Now, before we get started, we probably should define exactly what shoulder pain means, because people define shoulder pain as different things. Some people describe it as pain in the front of the shoulder, some people the outside of the arm, some people the back of the shoulder, or some people even up here, which is actually sort of part of your neck. So we're going to start out with shoulder joint proper. Anything around the shoulder joint, the front, the side, or in back of the ball and socket joint. That includes the joint itself, the ligaments, and the rotator cuff. Then at the end, we'll go through tips for the neck or upper trapezius area right here. So let's start with prevention. Prevention is absolutely the best way to treat any problem, stopping it before it starts. So with shoulder pain, if this is the one that hurts, lying on this side, particularly with your arm directly underneath of you like that, is one of the biggest causes of shoulder pain from sleeping. The reason for that is the rotator cuff gets stretched over top of the shoulder, and particularly the tendon part of it. Now, tendons don't have a great blood supply to begin with, but then when you stretch the tendon over top of the shoulder, compress the shoulder up into the socket of the shoulder, and then also you're not moving, so you're not getting great blood flow as it is. That's sort of a triple whammy that sets you up for shoulder pain. So one thing to do is to put your arm slightly out in front of you like this, sort of at a 30-degree angle from your body, 30 degrees out that way, and then rolled slightly back. This way the pressure is more through your shoulder blade and not through the shoulder joint itself. Additionally, it puts the shoulder in its resting position where there's the most space for the tendon without it getting pinched or compressed. Additionally, it's a good idea to hug a pillow like this. This helps keep this bottom arm in a good position and also helps this top arm to also stay in a good resting position. Now, one of the best things to do if you do have shoulder pain is trying not to sleep on the painful side. So put the painful side on top rather than lying on it, and then rest it over a pillow like this. Now, you also want to make sure that you have proper head and neck support, and this comes into the other type of shoulder pain up here that I was talking about. The nerves to your shoulder joint actually come out of the lower part of your neck. So if your neck is kinked too far over that way, that can actually pinch the nerves and cause pain here, or even down into the shoulder proper or into the arm. Additionally, it makes your upper trapezius muscle up here really stiff and tight if your head is hanging down like this. So you want to make sure you have enough pillow to fill the gap between your shoulder and your head with your neck in a midline position. So as you can see, this pillow is probably a little too thin for me. You can either double it up, folding it in half like this so that your head and neck are better supported, or get a thicker pillow. And I'll put some links down below to some pillows that do work pretty well for most people. You will have to see what works best for you. Next, we'll move on to what to do if your shoulder hurts when you wake up in the morning. So one of the best things that I find if I wake up with a little bit of pain in my shoulder is doing a stretch while I'm still in bed. If you're lying in a position, particularly with your arm up like this, or depending if you roll on your shoulder funny, it can kind of push the ball of the shoulder forwards in the socket. And that can start to pinch on the rotator cuff tendons. So while you're still lying in bed, lie on the painful side with your arm out in front of you like this, approximately a 90-degree angle to your body. Then bend your elbow a 90-degree angle, and then rotate down slightly like this. This is referred to as a sleeper stretch, and this is the classic way to do it. However, that can create some pain in your shoulder. It also can push the ball further out forwards if it's already forwards. So a modified version, and this is the one that I really like, is to push down on the shoulder like this. So kind of make your hand like a C, and then put that C right in the bend between your body and the shoulder. So you're pushing down on the ball of the shoulder. Roll into it just slightly. Keep the pressure down with this arm, and then let this arm sort of fall down towards the bed, however far it will naturally. And then if you need to, Put a little bit of overpressure down with this elbow, but make sure to keep the downward pressure with your hand. So you're pressuring down like this, putting the pressure through your shoulder with the hand, and then just a slight overpressure on the opposite wrist like this, and then hold this for a minute or so. Now, if you're doing this properly, you should feel a stretch in the back part of your shoulder. If you feel pain or pinching in the front of the shoulder, it's likely that you're not getting that backwards glide or posterior glide good enough with your hand. So try to reposition, really push down with the hand, and then let it fall until you feel a stretch in the back part of your shoulder. Now, if you still feel pain in the front, just skip it, because that means you're actually pinching things and you don't want to do that. Another great joint mobility option when you wake up is to sit and hold on to something, probably a chair. I can hold on to the edge of this bed, but likely your mattress at home, you're not going to be able to do this. So find a chair, sit in the chair, and grab onto it with your arm. Then just sort of lean away like that. That provides a slight distraction, kind of pulls the ball slightly away from the shoulder joint. And if you have been lying on your side with the ball compressed into the shoulder joint at nighttime, and this helps sort of give you a little bit more space there. Often makes things feel pretty good as well. If you do have some neck pain up here and you've been sleeping with your neck kinked over to the side, you can add to that just a slight tip away until you feel a little bit of a stretch up in this neck and shoulder area up there. So those are a couple joint options for stretching the shoulder joint. Now, what about the muscles? Rotator cuff pain is one of the biggest causes of shoulder pain, and that may range anywhere from just an irritation to a tendinopathy to a rotator cuff tear. But when you're sleeping at night, your rotator cuff muscles aren't getting a great blood supply, and that can make them more prone to knotting up or stiffening up. So doing some self-massage techniques can often release some of those knots and relieve some shoulder pain rather quickly. One of my favorite techniques is grabbing on one of the rotator cuff muscles here, known as the teres minor. There's also another little parallel muscle or bigger parallel muscle right below it, known as the teres major. And just find around here, kind of strum with your fingers, pinching on the little piece of meat underneath your armpit until you find a little bit of a sore or tender spot, and then just hold pressure on there 30 seconds to a minute, or sometimes even longer than that. Just hold the pressure until you feel like that knot sort of starts to melt away underneath your fingers. It should also feel kind of like a hurts but feels good type of pain. So that's one trigger point release for your shoulder. Another area that's really good is reaching back behind your shoulder like this. There's a little ridge of bone right here known as the spine of the scapula. And right below that, there's a muscle called the infraspinatus, meaning underneath the spine of the scapula. So you strum around here with your fingers until you find a sore or tender point. Depending on your flexibility with this arm, you may or may not be able to reach that. You also may or may not be able to get a good amount of pressure back down into there. So if you can't get enough pressure with your fingers, you can also use a tennis ball. This works really good for the infraspinatus. I will note that this is much better to do lying on a floor or other hard surface than it is on a soft bed. I can do it on this treatment table because it's a little more firm, but I'd suggest a floor, or if you can't get down on the floor, take a baking sheet and put it underneath your shoulder so that it provides a firm backing for the tennis ball. So you'll lie down and position the tennis ball right underneath your shoulder blade. So if the pain is right there, you're going to kind of pop it in underneath the shoulder blade and then lie on it like that, roll around until you find the sore tender spot, and then lie on it again a minute or so until it feels like the pain slowly melts away. You can also do this on the teres major and teres minor that I was talking about earlier. If you lie on your side, kind of in that sleeper stretch position that we started out in, and put the ball right underneath there on the side of your shoulder blade, and then roll around until you find a tender area. I think it also kind of helps to put that backward glide on the shoulder, or to lift up a little bit like this to help localize into the right spot. Once you find it, then hold that position for a minute or so, or again until the pain starts to lessen. Now you can also do trigger point releases in these muscles up here, the upper trapezius. And one great way to do that is to take your fingers and strum along the muscle. The muscle fibers run in this direction right here. So you want to go perpendicular to the fibers or across the fibers. And at some point, you'll probably feel a knot or a tense area in that muscle. Once you do feel that, again, kind of clamp down on it between your thumb and index and middle fingers, just enough that you feel sort of that hurts but feels good type of pain, and then hold that pressure again a minute or longer until the pain starts to melt away. Now, there are also great ways that you can use a massage gun to release those trigger points if you happen to have one. I've got another video that shows you how to do that over there. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.